1. Check client record and ask the client about latex allergy. Number 2. Assemble equipment, package of gloves. 3. Ensure the sterility of the package of the gloves. 4. Introduce yourself and verify the clients. Identify, explain to the client what are you going to do, what what is necessary, and how the client cooperate. Number 5. Observe the infection control procedures. Remove the outer wrap from the sterile gloves and leave the gloves in their inner sterile wrap on the sterile field. Unwrap the sterile gown pack. Wet the hand and forearms under the running water. Apply the soap as described early in step 7, maintaining the hand uppermost. Use firm rubbing, circular movement towards the palm, mask, and wrist of each hand. Interlace the finger and thumbs and move the hand back and forth. Continue this motion for at least 15 seconds. After washing and rinsing, use paper towel to dry one hand thoroughly and rotating motion from the fingers to elbow. Use a new towel to dry the other hand and arm. Dry hand and arms thoroughly with paper towel. Discard the paper towel in the appropriate container. A crease near at the neck. Hold it away from you and permit the foot unhold freely without touching anything including the uniform. Put the hand inside the shoulder of the gown and work the arms part way into sleeves without touching the outside of the gown. Have a co-worker the neckties without touching the outside of the gown and pull the gown upward to cover the neckline of your uniform in front and back. The co-worker that ties the neckties. Donning sterile gloves using closed method, work the hands down sleeves only to the proximal edge of the cuffs, or if donning sterile gloves by using open method, work the hands down the sleeves and through the cuffs. Have a co-worker take 2 ties at each side of the gown and tie them at the back of the gown. Make sure the uniform is completely covered. When a worn sterile gown should be considered sterile in the front from the waist to the shoulder. The sleeve should be considered sterile from 2 inches above the elbow to the cuff, since the arms of scrub person must move across the sterile field.